think about our health. Doctors say a glass of wine a day can extend your life. Cheers. Looks like we're gonna live forever.
Ooh, I have to say, Phyllis, here we are again, 3 years later. But I can say the difference is, as we've spoken on the phone, Reatha's with us right now. I
I'm
do
sure
feel
she
her
is.
here.
I'm
Yes.
sure she is. It's just, you know, two of the nicest women I've ever had the pleasure of being associated with, and they're gone. And I have to consider them guardian angels.
Yes, they definitely are. Now, for those of you out there, if you recall, Phyllis Quinlan and I have worked together on Frank About Health. She as my forever lovely co-host. Even if we haven't done shows together, we're still co-hosts together. That's the way I view her. And in this particular episode, it is called Healthcare Disruption, Fact or Fiction. And we'll talk about why that title in a minute. But I have to first say that one of the things that we will discuss today is the passing of our dear friend Reatha Grey. Phyllis and I did the same kind of tribute with Reatha when Betty White had passed, but that's not the reason why we're celebrating Reatha, just to do a commemorative, retrospective tribute. It's because Reatha Grey represented a light in terms of showing people the way to make change for themselves, whether they were actors, whether they were in government, whether they were advocates, like I always talk about, like I did on Frank About Health with Sam last week. Um, and Reatha in particular also dealt with the constant disruptions that existed in healthcare back in her day, as well as what we are experiencing today in 2025. And another reason to really pay homage to that scene is because that was the very moment after I saw that scene when I heard the news that Reatha had a heart attack and unfortunately only had a matter of weeks to live. But I'm also pointing out that that was I like to use the word aha moment, but that was a pivotal moment because her passing was a message to all of us how we take charge of our health and our life and our vision of what it is to live in a high quality of life that's good enough for ourselves and our families. That's why I think that not only is it appropriate for us to show that scene as a tribute to Retha, but also as a lesson for all of us that, especially in the next hour, as we discuss about the healthcare disruptions that are going on in our society, are things that we need to be aware of and to try to discern what's fact and what is fiction. So I would have to say that today is not only a tribute to Retha, but it is Retha allowing us, me and Phyllis, to educate you all out there about the various disruptions that are going on in policy, in technology, in medicine, and in other areas of healthcare that can sometimes be misrepresented by the media. But what I'm hoping is that Frank About Health will lead you in the right direction. So that being said, Phyllis, I will issue my disclaimer as I've always promised to do, because these are the facts and the views of Frank About Health, or rather, of our conversation that we're going to have today. They're not the views of TalkRadio.nyc or of any other third party media outlet. We are just giving you organic information that Phyllis Quinlan, a well respected executive coach, health and wellness nurse in one of our New York City hospital systems, is going to provide you her experience and her wealth of knowledge from that experience so that you can all learn and work with that information. And of course, me, who's now this is the 135th episode of Frank About Health. So all I have is history and consistency of the information that I've presented to all of you. So I hope you find this episode to be informative. And if you don't find it easy to believe, then just don't watch the show. I don't mind saying that anymore. I just want real people to watch this show and we can all learn together. So that being said, thank you,
Well said.
Phyllis, for coming back to Rank About Health.
That being well said, my friend. And it's a
Thank
joy to
you.
be back. It's been a while.
I
It's been a
know.
while. I just have to say, there was a piece of me, no one ever wanted Betty to pass. All right. She was
No.
everyone's grandmother, and we all grew up with her. She was a part of a comedic tribe, Carol Burnett, Lucille Ball, Betty White, I mean that whole genre of really sincerely funny women. And I can remember growing up and watching her on shows like Password, let alone Golden Girls or any of the other programs. But knowing that she was 99, pushing 100, you somewhat were prepared to say
Yes,
goodbye. You know,
exactly.
I was not prepared for Retha.
No. No.
I read your email and I read it and I read it and I couldn't believe it. And then I did this internet search because I thought you have to be mistaken. Like this is just a bad dream or a bad rumor. And
Right.
I just feel, even though, hand to God, I did not know this woman as well as you did. She was not a part of my life as she was for you. But for the
Hmm.
short period of time we worked together and collaborated together, it was her dignity, her
Yes.
her professionalism, her caring heart was palpable, and
Yes.
I felt it, and her talent, and I felt it, and I just feel the loss of this amazing woman, so acutely and so suddenly and so young.
Mm. Yes. Well, 75 years young, but still, if you
75
look at
years young, but yeah, I
I
just
thought she was going to be here till Betty.
I
Like,
thought she was going to give Betty a run for her money. Do you know what I mean? I just did not see this coming, and it's good to know she didn't suffer. It's good to know her family was with her,
yes.
and those kinds of, and the tribute that she received. It takes the edge off the grief, but I still
Yes.
feel the loss.
Yes. And I think that what was unique to me, um, which can help you, I mean, however you might be feeling the loss, is that I literally got the message that she was ill after seeing that scene, which is from the documentary.
Hmm.
And then I was in touch with her husband, and I was in touch with her cousin, and I was in touch with her manager, and we were all experiencing her transition because
Hmm.
the stroke and the heart attack led to her being on devices to keep her alive.
Which
But
she did
when
not want.
her
Yeah,
advance directive indicated
thank
if you
God.
can't, by the
Right.
31st of December
Hmm.
2024, if you can't do anything, I want to be removed. She
Hmm.
asked for that to happen.
Hmm.
And when she had transitioned, I'm here in New York. She was obviously in the West Coast. I felt it at 8:01. I was eating dinner.
Hmm.
I dropped the sandwich and I said to my parents who were around me,
Hmm.
she just passed. And I got the call half an hour later confirming time of death,
Yeah.
8:01.
Yeah.
I felt her going through me, and I felt her
Mhm.
through me when I went to the West Coast to issue my eulogy and memorial tribute. And I just remember her telling me what to say and what to do, even when I came home. So I guess the difference here is that if she was going through me during her transition, then this is how she wanted to go. So
And
that takes
yeah,
away the grief,
yeah, it,
you
it
know?
does. And then, when your own personal sense of loss, starts to subside, and
Yes,
you start to realize, as with Betty, Retha's was a life well led, and
yes,
she was far from one-dimensional. She
yes.
she was engaged in life to the fullest, to the end.
Mm-hmm.
And she's the legacy that she is leaving behind, and is just incredible. And I'll work all my life to try to even match it. But I just, envision her sitting with Betty, laughing their butts off, and just poking each other and drinking huge glasses of wine. That's how I
Exactly,
choose to remember them both. Yep.
exactly. Wow. So I think that it, okay, Reatha, this is how we want to pay tribute to you because you're with us right now, okay? I mean, one can say that like when Betty passed, I mean, you had tribute shows and a lot of press and whatever. I mean, and rightfully so. In this case, she's still getting it even while she has passed, as if she's still working with us. I know her show, Retirement House, misses her. terribly. It's unfortunate they've
You
actually
know, I
lost her.
just, she's such a joy. I mean, here she is, at her grand age and on TikTok and doing all those things because she wanted to bring joy and a sense of engagement to
Yes,
elders who she felt was isolated. And,
yes,
similar to Betty, she did the universe's work, Betty with her desire to help animals. And then
yes,
Reatha, I don't know if too many people realize that Reatha left the business in 1991 to return in 2007. But between 1991 and 2007, she was around the globe doing missionary work. And I don't think people really know that. And it just
correct.
speaks to her talent because how many people, get to a place on the West Coast
Yes,
and hope to God it's going to be there on Monday, but she had the courage of her convictions and a calling, a
yes,
humanistic calling to walk away from, the career she was having and then do the universe's work. And then, as the universe would say, thank you very much, and here's your career back. And, she was more popular than ever. So
absolutely,
it's quite a lesson, quite a life
absolutely.
lesson.
Absolutely. And it's kind of funny. What I had learned about her missionary work, it was when she appeared on Frank About Health, my last show before the holiday season. I'd known the woman almost 12 years by that point, and that's the first time I found that out. So
Yeah.
I guess we all have our own hidden talents and hidden
Hmm.
missions,
Hmm.
and you need to retain it for your own self-preservation, but at the same time, give out to the population at large what you can, like you say, do the universe's work, but still keep a part of yourself discreet because that's where you get your fuel to continue to recharge and continue to give your best quality work out there
Yeah.
to our fellow
I
humanity.
think what she was really trying to do was she had her life was in compartments. You know,
Yes.
she had
Yes.
her family life and her marriage and her child and her friends. And then she had her professional life, in show business. And then
Yes.
she had this piece, but she didn't really blend them. In other words, she didn't use her celebrity as part of what she was doing with her missionary work. That was something very private, very personal, and very committed because, that was almost 18 years she was away from the business
Yeah.
and and doing that kind of work in a very selfless way. And I'm sure it fed her soul in more ways than we can even imagine. But it was
Absolutely.
good that she came back so we could enjoy her up to the end.
Absolutely. All right, ladies and gentlemen, we're up to our first break. Though this whole conversation that Phyllis and I just had about Retha is actually a primer for the rest of the show. We just talked about a wonderful woman that went through a healthcare disruption. It disrupted the lives of various people in her life, whether it's positive or negative or neutral, but it serves as a foundation for how we're going to spend the next 45 minutes of the show mentioning that there is disruption in healthcare continually on a chaotic daily basis. And we want to spend the next 45 minutes with Retha's example, putting it all in perspective so that each of us can leave at 6 o'clock and really map out what it is we can do to continue preserving our existing healthcare resources, as well as our opportunities to manifest with new technologies, as well as new medicines and possibly new cures without the noise, which we also want to muddle through. So,
Mhm.
ladies and gentlemen, please stay tuned for our next segment right here on TalkRadio.nyc and on our Facebook, LinkedIn, YouTube, and Twitch channels right here on Frank About Health when we will be right back. Stay tuned.
Are you a conscious co creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on TalkRadio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on TalkRadio.nyc at 5 p.m. Eastern on Tuesdays. where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to the hard skills on Tuesday at 5 p.m. Eastern on TalkRadio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Hey, everybody, and welcome back. So, Phyllis, we were talking on the phone as well as even before the show began about all the noise that is going on every single day in the media about what we have today and what we might lose tomorrow. Um, Everyone knows about my cousin being in a nursing home and today's news about Medicaid being cut short. I can't even begin to see how that's going to impact. I mean, I can't begin to imagine how that's going to impact my cousin in her new residence, that being said. So, why don't you start off this segment to talk about the disruptions in healthcare that are affecting our policies and whatever resources we currently have that are at risk of being taken away?
So I just want to, preface my words by saying I'm not an expert in any of this. And quite honestly, I don't think there are any experts out there.
Hmm.
And the reason for that is that the message and the information is changing constantly. In the past, we could, pretty much offer resources, and I know we have put some links in the chat and everything. But the information is changing, and for the first time, places to go get reliable information, not just hearsay information or rumor information. Many of those sites have been wiped clean.
Hmm.
So it's very, very hard. The Department of Health sites have been wiped. The CDC, Center for Disease Center, Control rather, those sites. Information has been taken down. Linkages have been undone. So it's very hard to get reliable information on what's going on. So you have to be, number one, we're going to talk about a few things, but you have to be very self-reliant about who you're getting your information from and where you're cross-checking that. So, sometimes that'll have to be conversations with your physician. Sometimes that'll have to be conversations with your insurance company. And then, of course, trying to find the most reliable things. I know that in response to some of the information being taken down from the Center for Disease Control and other such sites that offer resources, the American Medical Association is putting that information on their site. So that is one of the sites I would say keep in mind from checking from time to time if you have questions, because I know they're doing their best to backfill information that is no longer available on the government sites that we used to use day in and day out. That's number one.
Hmm.
So where else to begin? Let's just say, you're going to have to check with your private insurance companies as to what is covered and what is not covered, because usually private insurance companies will mimic or very much have parallel coverage to Medicare and Medicaid. It shouldn't, usually private companies will not go below that, but sometimes they go above that. And of course, that comes at a price. If you are employed, it's important, again, to find out what are your benefits and what has changed, and are some of the government benefits that come with Medicare or Medicaid, are some of those benefits going to affect your coverage? So again, if you are employed and you have insurance through your employer, that's probably your human resource department is probably your most reliable source as to checking information. If you are on Medicare, and everyone is entitled to enroll in Medicare at age 65, you should enroll in Medicare, or at least start the enrollment process. They recommend 3 to 4 months before you are turning 65. So now, how to do that? That's a very good question. How do we do that? Because some of the ways that we've been able to enroll in these things are starting to change. So again, do you have to show up in person? Is it something you can do online? Is it something you can do to schedule an appointment with a representative so that you can enroll and answer all the questions and do what you need to do with someone over the phone? Same thing with Social Security. Do you have to go down to the Social Security Department now in person? Do you, and what documentations do you have to bring? You know, can you do it over the phone? Can you make an appointment to do that over the phone? These are all things that we did have access to in the past and now are all changing. Here's the tormenting piece, Frank, that concerns me, is that
I'm ready.
last week, you know, you could, you know, they were saying that they were limiting access to Social Security information and being able to access your Social Security. And then, of course, there was a major uproar from citizens about what about disabled elders or elders that can't go down and don't drive and, you know, whatever. And then, of course, now they rolled it back. And here's the dilemma. And this is what I want to caution your leaders about, and is that you have to stay on top of the information, because the information and the disinformation are getting blended. And one week it's one thing, and then the next week it's something else. And nothing will confuse you more than that kind of information, yes, no, slap, hug, back and forth, back and forth. And I don't understand the professionalism or the reasoning behind this other than to disenfranchise people. I'm sorry, but that's what I feel. I feel the confusion is to frustrate and disenfranchise and have you not enroll in things that you are entitled to enroll into. So again, you know, do we have to seek a little legal counsel from our, you know, a friendly attorney that you might have access to for family business? We're just going to have to get as much counsel as possible as to what's current for today. So what's happening on April 10th may not be exactly what's happening on April 15th, and so on. And this is really, really problematic. As I understand it, the big changes now to Medicare have to do with Part D, which is the Part D covers the medications.
Yeah.
And that the deductible pieces, you know, have changed, and some insurance companies are upping that, some insurance companies are lessening that. But again, you have to speak to, you know, or have to find out exactly what the current information is, because it looks like it's the changes to programs are not following the tried and true methodology. In other words, it should be a proposal or a bill that goes through the Senate and the House, and then everybody's informed as to what the changes are, and it's signed into policy. What's happening now is things are changing on a daily basis with executive orders. So it bypasses the Senate, it bypasses the House of Representatives, and all of a sudden, in 24 hours, something is not what it was 24 hours ago.
Right.
I can't fathom it. I can't fathom it, especially when all of us, you know, at a certain age have paid into these programs all along. So, you know, stay in touch with your representatives, your political representatives. Try to find out as much as you possibly can from them as to where you stand. Again, the American Medical Association is trying to do a very good job of keeping reliable information that used to be available on government sites that was taken down available to the American public.
Yes.
So that's really my best guidance in that case. What's happening with Medicaid is something very different. And as I shared with you before the program, I'm just learning that the House of Representatives and the Senate have just passed a bill that cuts Medicaid by $880 billion by the end of 10 years. And what's concerning here is that the comment that the Speaker of the House made was in reference to lazy people sitting on couches should get up and do something for themselves instead of playing video games. And I don't think there's a full appreciation by the American public of how many indigent people and people who cannot, by virtue of physical or mental disabilities or developmental disabilities are reliant upon Medicaid. So 2/3 of the nursing home population in this country is covered by Medicaid. So I'm not sure what they're looking to do here. I don't know what's happening. 2/3 of children are covered by, no, I don't mean to say 2/3. Children are covered by Medicaid. Disabled people are covered by Medicaid. Those with mental and developmental challenges are covered by Medicaid. And I can tell you, I don't know too many hospitals that aren't having a large portion of their reimbursement covered by Medicaid. So that said, I think that we're going to find many rural hospitals and healthcare systems in dire jeopardy for, and really at risk for closing one service after another before the hospital itself closes, because they're not going to be able to they're not going to get payment for services. And of course, that's just a recipe for bankruptcy and having to close. So again, I am not the living expert in this, but I do understand some and part of this. I know the concerns that are being voiced in healthcare and healthcare administrative circles, as to, we thought we have a budget for 2025, meaning a healthcare organization might have a budget for 2025, only to never see this coming, so to speak, and have to scramble for, what are we going to do if this happens, and what are we going to do if that happens? So it's really putting a great burden onto hospitals that have been servicing everyone. Hospitals don't turn away people. They present to the emergency department, and we have the ability to stabilize them. We can admit them, we can transfer them, or we can discharge them. That's our three options. But we can't just turn them away and say, if you're not insured or you have Medicaid and that's not going to give me enough reimbursement, we can't not treat. It's healthcare is not just the business of the business. The healthcare is delivered by people who are among the most generous people on the planet, that are clinicians that have paid hundreds and thousands of dollars for their education, are dedicated to the service of mankind, and really are going to have a lot of moral dilemmas and outrage, So that's a piece there. There are some concerns among the healthcare community about ICE walking in and taking patients out of hospitals, and that's real. So there are those hospitals around the country that are starting to put out protocols and algorithms that if a representative of ICE shows up, here's what you need to do. But ICE cannot just walk in and demand that you disconnect a patient from a medication IV or something, and so they can take them out of the hospital. There were rumors that they could do that they were allowed to do that. As my understanding is, they are not. That we are to ask for their identification, that we are to notify administration, and then let administration, security, and the hospital lawyers decide what's going to happen. But you cannot disconnect somebody from treatment that might be life-sustaining. So, we're gonna let the administrators and the legal eagles, talk about that.
Well, we're about to take our second break, but before we do, I just have to say, based on everything that you just beautifully presented, the one thing that I see happening is this executive order process oversteps the checks and balances of our congressional
That's exactly
leaders.
right. And that's what's so disconcerting, because it can happen overnight.
That makes anyone, you, myself, really rely more on our local government than the federal government at this stage. Is that a fair assessment?
Oh, well, I can't, I'm not going to push back on that. I think part
Okay.
of the thinking here is to let the states drive their own machines. And I'm not saying that's not okay. But if we're paying federal taxes and have federal programs, then there's just so much the local infrastructure is capable of running.
Right.
So, you would like to see the checks and balances and the discussions and the arguments and the win-win come out in a bill, but that's just does not seem to be the process right now.
So there you have it, everybody. Fact or fiction? The policies and resources you currently have, are they changing because they're supposed to, or because somebody out there wants it to? That's up for you to decide. Ladies and gentlemen, when we return, we're going to talk about another healthcare disruption, but actually can lead to opportunities as well, depending on who you are. And that's in the area of AI and technology. So please stay tuned. We'll be back in a few.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on TalkRadio.nyc, I host a program, Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on TalkRadio.nyc.
Hi, I'm Linda Marsanico. The A Train to Sedona is a memoir about my journey to love and compassion. It's also the name of my new broadcast on Wednesdays at 12 noon. When we are spiritual, we embrace possibilities and ideas, which strengthen our mind, body, spirit, health, and wisdom. On the A Train to Sedona broadcast, I plan to interview guests who embrace these expansive practices. Join us on Wednesdays at 12 noon on Talk Radio New York City.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back. Now, Phyllis, that was an excellent overview of everything that I have already personally experienced in terms of the changes within both Medicaid and Medicare. I'm not going to spend any part of this show talking about my personal experience because I'm just saying that I think I'm one of the best barometers to see the impact that is being created with our new leadership, which in itself just makes me want to rely on our own self-advocacy, whatever we are doing, whether or a professional nurse like yourself, or whether I'm just hosting a health podcast. But I'm really looking to create impact and awareness, well, just like
Right.
what I told Sam last week, especially when you have self-awareness, that's at least a good head start in all of this
Right.
chaos that we seem to be experiencing.
I'd
However,
like to add one more thing
Sure.
before we shift topics. Just like to add, just talk a little bit about the issue of vaccines. And I'm not
Yes.
here to influence anybody's decision to get vaccinated themselves or to allow their child to be vaccinated. That's a very personal choice to make. And hopefully you make it with information and your physician and reliable information. But I do want to raise awareness that everybody should be, if you're choosing not to vaccinate, please do a deeper dive into making yourself aware of the signs and symptoms of the diseases that we have vaccines for. So right now we're having a tremendous measles outbreak, and I think it's, everybody knows it. We're talking about measles outbreaks in now Texas, New Mexico, Oklahoma, that whole area, and children becoming sick. And I think what's been reported is 2 children have died or passed from measles. Again, I'm not here to influence your decision. I just want you to understand and make yourself informed about the consequences of measles, because everybody thinks it can be a benign, disease, and it can have some serious consequences. So, please make these decisions not from a sense of politics, but from a sense of real information from reliable sources like your physicians and your healthcare practitioners. We're seeing things now with, measles is the first thing to come along. And here's what's going to happen. The next thing to come along is going to be mumps and rubella, because the vaccination that we have for measles is a 3-part vaccination. It covers mumps, rubella, and measles. Okay, it's called an MMR. So if your child has measles or is exposed to measles or at risk because they're not vaccinated, they're also at risk for mumps. They're also at risk for rubella. If your child, we've had several children in the New York area admitted for diphtheria. All right. So when that happens, it's not just diphtheria. Diphtheria, the vaccination for diphtheria is something called a DPT. Okay, it's diphtheria, pertussis, and tetanus. We don't individually vaccinate for individual bacterial infections. It's a group vaccination. So that if there's an exposure or an outbreak of diphtheria, you can think that you're definitely at risk for an outbreak of pertussis, otherwise known as whooping cough. And there's nothing more agonizing than trying to see a child or an adult, for that matter, gasping for breath and coughing at the same time. And if you've ever tried to cough and breathe at the same time, it's physically impossible. So, it's not just an infection that you will get over. It is really struggling to breathe, and the work of breathing is really hard. So again, make these decisions with information. Tetanus is deadly. I just want to say that out loud. Anybody can Google tetanus. One of the reasons, but tetanus can cause muscle spasms and different types of trouble with your respiratory muscles, and you can certainly be struggling to breathe with tetanus. It can cause neurological damage as well. So please, again, if you're, I'm not here to influence your decision. I respect your decision to vaccinate or not vaccinate, but I'd like you to do it with information that is really reliable, and that you understand childhood diseases are not the reason why we developed these vaccines. Was because of the serious consequences of this. If in a time when polio should be eradicated from the face of the planet, smallpox should be eradicated from the face of the planet. The thought of having some child's mobility taken away by a vaccine preventable disease is heartbreaking.
Exactly.
Absolutely heartbreaking, because there's no cure for polio. If you get it, more than likely you are going to have some residual effect that will be life-changing. So these are things. Now, for those of us that are older, if what your feeling is about vaccinations, but I am part of a scientific community. Everything we do in nursing and in the healthcare professions is evidence-based. I personally have made the decision to take the vaccines that are offered to me. I've had probably 8 doses of the COVID vaccine. I get the pneumonia vaccine, and I get the flu vaccine every year. And I'm fortunate. I've never had a reaction to it. I understand other people do, but I do think that these are things that we have to take seriously and realize that there are consequences for not having those things. And again, when we talk about disruption, if hospitals are closing because of lack of reimbursement and access to proper health care, should you get sick from a vaccine preventable disease or a vaccine diminishing disease, again, there's a ripple effect here. It's not so black and white. So please be thoughtful in your decisions. And I guess that's really all I want to, share at this point on that.
It's beautiful because it literally goes into the next topic, which is about healthcare technologies. And one of the things that we learned during COVID was the mRNA vaccine, which is a technology. It's not getting injected with an actual disease like COVID. It's getting vaccinated with the genetic markers or the genetic codes that help to reconfigure the illness within your bloodstream, and therefore create immunity to prevent getting the disease or spreading it to others. And that in itself, during, what did they call it, Operation Warp Speed back in 2020, that literally managed to start the downward trend of all the deaths that we were experiencing, especially here in the New York area, if you recall that wonderful time that we had with the pandemic. But the thing is that as we were watching the advent of mRNA vaccines and then watching how our lives were turned into technologically accessible ways of living and communicating, Zoom, for example, or even just doing your shopping and your banking and living your life all with your trusty phone and whatever, it just showed that the technology as a disruption was helping to find solutions faster, more expedient, even to the point where I had remembered they were talking about mRNA vaccines or mRNA genetically produced serums, I guess is the right word, to find cures for things like cancer and whatever. So it's kind of ironic how when technology, especially in the area of vaccines, is a plus for humanity, it's pushed back for some reason. The resistance to progress, which is what it appears to me. I guess those that are resisting it don't look at it as progress. But can you give a discussion as to why, when there are improvements through technology, especially in the area of vaccines, that there's such pushback? What is it all
Yeah.
about economics, or
So
what would you
no,
say?
I honestly don't have a clear-cut reason for that. I don't
Okay.
have evidence-based references to support
Okay.
why people are pushing back. I don't know if enough studies have done that. Some of it is political, some of it's religious, some of it is just personal belief. Um, again, these are individual decisions to make, but you
Mm,
want to make them with the best information possible. I do know that there was some information out there about vitamin A and measles, and while vitamin A can be helpful in treating a case of measles, what we're finding is a lot of cases of vitamin A overdosing or vitamin A toxicity because people are taking mega doses of vitamin A as opposed to, and allowing themselves to get, if they are exposed, allowing themselves to get the disease, measles,
mm-hmm.
and then saying, well, I'll just treat it with vitamin A, as if vitamin A is the end all and cure all for this bacterial infection, and it's not.
Mm,
The thing to understand is that when you overdose on vaccines, more than likely you're going to put your liver at risk. And not on vaccines, excuse me, on vitamins. You're going to
right.
put your liver at risk because everything goes through the liver and it's excreted through the kidneys.
Right.
So, again, your liver can just do so much. And if it's
Right.
a child's liver, it can just do so much less.
Right.
So,
Right.
you want to make sure that, you're not looking at the signs and symptoms of vitamin A toxicity and saying, well, they're just sick from measles. They may be sick from the vitamin A. So you may want to seek some medical evaluation of that, because if you are benevolently giving your child mega doses of vitamin A and it's actually causing harm, I can't think of anything more heartbreaking. So
Right.
again, I'm not pushing back on the decision. I'm just saying do it with a sense of proportion, do it with a sense of information, understand that the body has a lot of ripple effects. You push here, it pulls there. That there isn't one universal answer for anything. I wish that medicine and nursing was cut and dry. It is not. It
Right.
is not. We do the best we can with what we have, and yes, it is evidence-based and stuff, but that's the important piece. I think one of the biggest disruptions going forward is the lack of funding we're going to have for research. I cannot, for the life of me, Frank, understand
Mm,
what is the benefit of pulling research for cancer. Why would you defund research for cancer and diseases that we are so close to getting our arms around? You know, um, if you were diagnosed with cancer as early as 25 years ago, your prognosis was not what it is today. I mean, through the research, we have found out so much that we can do with cancer and other diseases that in the past have really, caused death or severe harm. We now have the ability to do some therapies that can turn around sickle cell. Why would
mm,
you want to stop that research?
mm.
It makes no sense to me. But but again, the lack of research going forward in some very, very important areas will prove to be a disruptor in the future.
Right.
We will be behind the eight ball, and quite honestly, um, the health of the United States will fall behind that of other industrial countries on the planet. We will just not be as healthy as we were.
It just sounds again like for them to cut the budget, therefore cut the research, and therefore cut the excess for the vitamins, the vaccines, the nutrition, the whatever it is just, you know, an act of not looking at humanity as anything but a commodity. That's what it appears to me.
Yeah,
So,
I don't know if I would go that far, but I don't think
I
there's
mean,
anybody that isn't going to say that, certain things in the government could certainly use a deeper dive in. Are there efficiencies? Are there inefficiencies? Are we funding things that could be considered a little on the ridiculous side, or are we funding things that are really going to shift and improve the life of people on this planet? But
right.
those kinds of deep dives need to be done with a scalpel and not an axe,
I
because
love that
because
analogy.
people's lives are at stake here. This
Exactly.
this is this is not good. People's lives are at stake, and we're not saying that, there might be some waste over here and some oversight needed over there. But they're doing away with the funding for, Food and Drugs Administration. So the people who let us know about bird flu and eggs, or there's a recall of a meat product, or a recall of a fowl product, or a recall of something else. These people are not, that safety net is being really slashed left and right, so that we are going to be exposed to things that we had a safety wall, or a firewall, if you will,
Right.
there to keep us safe. So the indiscriminate just shutting down of things that were put in place to keep us safe without doing due diligence, I just don't understand what people are thinking.
Mm. So there you have it again. Fact or fiction. When you return from the break, we will wrap up with future thoughts, takeaways, and just overall from the information you've gathered on today's episode with me and Phyllis of Frank About Health. Let's take what we presented as fact and make it your nonfiction story going forward with your healthcare. We'll be back in a few.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on TalkRadio.nyc, and I will continue to be frank about health with all of you.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays, 12 noon on TalkRadio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Hey, everybody, and welcome back. Now, over the last 45 minutes, and I know I went a little over in the last segment, everything Phyllis was saying needed to be said. So I apologize back there to the engineer that we went over. We had to, all right? Information is power. That being said, I think that this is the best time for you and me, Phyllis, to just take all of what was said and forgetting the title of today's episode, Fact or Fiction. The fact is you provided facts. It's just with all the noise that you have made clear is out there in the media and whatever, we don't know what to believe. We don't know what's true and what's not.
And that's the most dangerous thing, Frank.
Correct.
Yes.
And that's why what I'm hoping is that all the listeners on today's show realize that Frank About Health has been there to be frank and transparent and open about what is real. And at the same time, for everyone to own it within yourself. Like we mentioned earlier about Reatha, how she owned within herself her knowledge of being out there as a missionary for others that were homeless and helpless and vulnerable, you don't announce that out loud like you announce a new product on television. But
Mm.
the thing is that that's the one lesson that I would say Reatha provided in her own life experience, that when it comes to our own healthcare, that is our story to manage. Nobody needs to know about that. Not the political systems out there, not the media, not well, your doctors need to know, obviously, so they can work with you, but your own brain, your own knowledge and information, and it can't be allowing all the noise to distract. So, that being said, what I really think one major takeaway is to understand that healthcare disruption is part of today's culture. It's unfortunate how it became that way. But if you remain local, if you remain true to your local doctors, your local government, even if it's just your city government, at least for the moment, you can start to reframe and regroup and use your existing resources like your Medicaid, like your Medicare, or your private insurance, or whatever other financial resources you have, and to continue to get vaccines and to embrace new technologies for new solutions and new cures. And even if the bigger government at large is trying to cut funding and cut access and cut resources, you hold on to the resources you have and build from there and become what I said on last week's episode of Frank About Health, almost like a fighter, not just an advocate, a health fighter to educate and model after all of those vulnerable people out there to get them the cures and solutions that they need. Now, the big disruptor of all is artificial intelligence, but the irony is that since it takes an individual user to explore it and to explore its efficacy, rather than to determine if all the noise out there is that it's not to be trusted, it's going to take away your job, it's going to do whatever. Well, that might be true in certain industries, but from my knowledge of AI over the last few months in particular, is that when it comes to healthcare, it is accurate. It is perfect, and you get resources much quicker. So I would highly recommend everyone out there to make friends with ChatGPT, to make friends with Perplexity, which is, I know, a big search engine for healthcare issues and treatments and methodologies and research and stuff like that, or to even do what you can to just get the expediency that you are looking for, especially in what looks like, from what we've discussed, Phyllis, to be a slower acting social system that we once called our government. I mean, I don't
Mm-hmm.
know what to call it anymore. I
Mm-hmm.
just call it chaos.
Mm-hmm.
The stock market itself has
Mm-hmm.
reflected that the past week. So the thing that I'm hoping as another takeaway is that you and I talked about an upcoming book called The Great American Healthcare Disruption, written by the CEO of a medical system in Michigan, Dr. Marshall Runge, someone who I have had a chance to talk with and read some of his material, and he is definitely one person who can speak to healthcare disruption. And I know, Phyllis, we talked about seeing if he will be available to be on the show soon. I'm going to let fate
Mm-hmm.
and the environment that we're dealing with
Mm-hmm.
determine that. I'm no longer going to push for what needs to be and what can't be. I think I've learned, especially after the last 4 months, I can only go with what I'm given. And if
Mm-hmm.
something's taken away, it wasn't meant to be there to begin with,
True.
So it keeps me balanced, a little bit shot, burnt out, but you know what? This is a new year, and I'm going to thrive in 25. But if it wasn't for you, Phyllis, and I've said it over and over again, I would probably not be as balanced as I've become over the last few weeks. Your support, especially when it came to my cousin, is priceless. So and we're now 3 minutes to ending. So I think, just in a nutshell, Phyllis, what would you
Mm-hmm.
say? There's three takeaways from this episode, right? One is stay local and true to your doctors and family support systems and your medicines and stuff like that. Two, um, trust your own judgment.
Mm.
Trust the knowledge that has worked for you in the past, regardless of what you hear today about what's no longer good for you or what is good for you. And then I guess three, everyone should learn to embrace AI technology when it comes to your healthcare. I think those are the three that I've come up with. Do you have anything else to add?
Well, I guess it's echoing some of the things that you're saying. If you have a healthcare support system, if you have a private physician or what we would call an internist, which would be a general physician, or you have a specialist cardiologist, endocrinologist, whatever the case may be, and you trust them, I put to you that these are the folks that will give you the most accurate current information on medications, vaccines, research that's out there, things that have been discontinued. Just keep feeding or supporting those kinds of relationships so that you can get accurate information from people you trust, as opposed to sources that you're not sure of whether there is an agenda behind those sources. Okay,
Right.
that's number one. Number two, read everything you possibly can. And then, as you said, use your own determination as to what's right and real for you. You can't just read one newspaper. You can't just, watch one TV news outlet. You have to be able to try to get the perspectives for 360 degrees of information to the degree
Right.
that you can, and then trust your gut as to, we're all knowledgeable, intelligent people, trust your gut as to what's right for you and what's right for your family.
Right.
And the other piece is, please don't put your head in the sand politically. This
Yes.
is not a storm that will pass.
No.
This is serious.
Yes.
And those who would influence your future need to be held accountable. We voted them into office for certain reasons, again, each to ourselves.
Right.
But we cannot take for granted that our democracy is safe. We cannot take for granted our health is safe. We cannot take for granted our vote is safe. So we have to stay on top of things and not put our head in the sand and cross our fingers and hope it all works out in the end. We're going to have to lean in and take part.
Correct. You and I are trying to continue sharing the care, right?
Yes, that's right.
Well, so ladies and gentlemen, again, Phyllis and I have been here for many, many episodes, including today, to pretty much say that when it comes also to your mental health, there is nothing better than having gaslighting through the media or through the internet or through other individuals who really don't know what they're talking about, and to just sit listening to them and believing that what you're hearing is true. What is true is, as Phyllis said, is in your gut.
Mm-hmm.
That is exactly how I felt about Reatha when she passed. I knew she passed because my gut told me she did. That is the biggest lesson she taught me. And Phyllis and I have been trying to teach you your own intuition, your gut, your health. That is number one across the board. And therefore, if you want to prevent disruption from taking away the access to healthcare that you're currently enjoying, I just was told, say it louder for the people in the back. Yes. Your health is number one.
Yes.
Without health, you've got nothing.
This is
All
true.
right. So if you maintain your health over the next week, you'll get another fresh episode of Frank About Health right here on TalkRadio.nyc. Phyllis, thank you again for being here.
Always.
I will
Always,
always thank
Frank.
you.
Blessings.
And hopefully we'll be here in a couple weeks with a guest if that materializes. But the only promise is that I will be here next Thursday. So take care. Thank you again, Jesse, behind the scenes. Thank you,
Thank
Sam,
you,
for
Jesse.
everything. Yes, and we will be available to download on YouTube, and on I'm Frank About Health is on Apple Podcasts now, and you can also continue to hear this episode again on our other social media platforms: Facebook, LinkedIn, and Twitch. All right, everybody, thank you again. We'll see you next week.
Good
Bye-bye.
night.
Good night.